Welcome to day one of the third Future of the American Child journalism training sponsored by the National Press Foundation. We are in Charlotte, North Carolina with the 16 journalists selected to participate in this program that explores the key topics and issues that American children are facing that will help journalists do a better job of contextualizing and communicating the status of American children. Last night we heard some very powerful conversations about systemic barriers and issues that children and families face, specifically in the area of economic stability. But this morning on day one, we'll start at the very beginning. We'll start with a conversation about the youngest Americans, the brand new Americans, babies. And we are joined this morning by Patricia Cole. She is the Senior Director of Federal Policy for the 0 to 3 organization that is based in Washington, D.C., and whose mission is to amplify policies and strategies for communities, states, cities, to ensure that babies and the youngest Americans have the best chance at life. So welcome, Patricia, and thank you for joining us.
Oh, thank you. I'm so happy to be here.
Well, I know that you've prepared a presentation for us and that you're going to really unpack the State of Babies report, which this year is your 5th time that 0 to 3 has done this report. But before I let you take it away, I wanted to ask you one simple question, and that is, as a journalist, my perception of how we cover babies in this country is that it's either they're cute and cuddly and they're props on TikTok, or if something really terrible happens to them, we give that front page coverage. So before you break down the State of Babies report, talk about why you feel it's important that journalists contextualize the lives of babies in America.
So we always think about the brain architecture, and I'm going to talk about this more, but it's really the foundations for all learning, all relationships that are laid in these first years. And so it's very important to understand that whatever happens to babies, and therefore whatever happens to their families, because babies generally don't come solo, is really laying the foundations for their future and for our nation's future. And so you really can't underestimate what's happening in those years, because everything after that gets harder if you don't make sure that all babies have what they need to thrive. And the other thing I'll talk about is the incredible disparities and the inequities that start even before birth. So we have a lot of babies who face a lot of risk, and we do tend to talk a lot about the gloom and doom and the threats, and that's a lot of what I'll talk about today. But I think it's so important to understand how many children are at some kind of risk, and also how families are really working hard to raise their children to be economically stable and what challenges they face. So thinking about the child as part of the family, but that development is something that our whole future builds on.
Excellent. Well, I'll let you take it away.
Okay, so I'm going to go up here.
Yes.
We have an interesting situation, so I don't have a clicker. So I'm going to have to rely on giving verbal clues. I have a lot of slides, so I will be sending out my PowerPoint to you, so don't worry if I don't spend any time on a couple of slides, but we'll try to move along here. So actually, Carlos, if we could just go to, just skip the second slide because Rachel's already introduced 0 to 3, and just go to the third slide. And because this 8:30 on Monday morning and it's cold outside, I thought we'd start with maybe a lighter look at why we're talking about babies. So if you play the first snippet.
Babies. They eat, they sleep, they cry. They do their diaper business, and that's about it, right? Wrong. Underneath the eating, the sleeping, the crying, and the many, many, many diapers, there's a lot going on. Their brains are forming over 1 million new neural connections every second. And these connections have an impact on how they learn and relate to others for the rest of their lives. Their brains won't wait, so we can't wait either. Now is the time to make sure that our public policies give babies what they need to thrive. That's why we're taking our message from the cribs to the capitals.
But I wanted to just give you an idea of why we're starting with babies. So I'm going to talk more about the brain development. Rachel had asked me to go a little deeper in that. And then I'll talk about the State of Babies Yearbook. And we're going to talk a lot about connections. So the brain connections, the connections with trusted adults. And then when we look at State of Babies, we want to connect those data points back to the science, but also we try to connect them together for policymakers so they can see the urgent policy priorities. So if we can go to the next slide, we'll dig into the brain development. So when I talked earlier about the fact that brain development is foundational, and we started out when we started talking to members of Congress about early development, we found that they would listen to the brain development and say, this is great, brain development in the first 3 years, let's do universal pre-K. So we tried to really explain that what happens to build those brains in the first 3 years is really important. So we came up with a metaphor of the house, that you're really building the foundation, and everything else is scaffolded on top of that in the brain and in the house, and if the foundation is weak, then so will the rest of the structure. So let's move to the next slide, which really gives us the start of the building of brain architecture. So when we're born, we have billions of neurons, but for the most part, they aren't connected. And so that's really the process of learning and development, is building all of those connections. And you can see how they proliferate just over the first 6 months. What happens in the first 3 years is that you're just building connections. Again, as it says, you can, if you want to advance in one, it'll tell you that what you heard in the video, that you're building 1 million new connections every second. But what happens then when you get to about age 3 is that you start pruning them away. And the ones that are pruned away depend on the ones that have been reinforced by your experiences. So it stands to reason that if you want strong brain architecture, you need positive early experiences. So we'll move to the next slide, and you're going to have to, I'll tell you when to click. So these connections aren't made randomly. They're made around different functions, and they peak, the number of connections peak at different times. So the first one, if you do a click, is the sensory pathways. The second is language, which peaks at about 9 months. So before that, babies can learn any language in the world. But after that, the languages or language that they hear is what's reinforcing those pathways. And then the cognitive functions peak at about 3 years. That doesn't mean that brains are fully formed, and it just means they have all these connections that then they're going to reinforce and make stronger. And then the last one is self-regulation, which for those with teenagers know that, or believe to know that at some point it will actually kick in. It peaks much higher, much later. The next slide, I was going to play a video. There may be another clip, yeah. So you can see that really important period of birth to 3, right, on these developments of these connections. So the next slide, I'm not going to play this video, but I'll send the slides, I'll put the URL in. But it's really to reinforce the point that, so we always think about and we hear, oh, babies are born wired to learn, and that's true. But they're also born wired to feel, and that's a real primal kind of drive for babies, because making those connections, those brain connections all occur, they're mostly impacted by experiences, and those occur in the context of close relationships with adults. And these are really central. When you have that close relationship, it literally helps the brain to organize, and that forms strong attachments, which then enable a baby to go out and explore the world, which is really how babies learn. So in the video, which I'm not going to show you, it shows how a baby reacts when the parent is totally non-responsive. And this is a baby who has a great relationship with the mom, and when the mom comes back, the baby's fine. But the point is what happens when that still phase is, the non-responsiveness is what babies see most of the time, or they have inconsistent caregiving, or they have kind of scary experiences in their world. So that all has an impact on how their brains organize. So let's move to the next slide. Okay. So what happens when young children are in these kind of threatening situations, or threatening from their brain standpoint? So we know from the adverse early experiences, or adverse childhood experiences, or ACEs study, that what happens in early childhood, there's some key things that can happen that affect what happens to you as an adult in terms of substance use, mental health issues, heart disease, other health issues, and even early death. And the key is that these experiences are cumulative, so that the more ACEs you have, the higher likelihood that you're going to have some of these problems later in life. And for babies, what this looks like is they show up in early childhood as developmental delays. So a child may not language might be delayed, or cognitive development, or even social emotional development. And these also are connected to problems down the road as adults. So you can see that the implications, not just for lives not being fulfilled, but also for the healthcare cost, the cost of loss of economic productivity, are pretty substantial. Let's move to the next slide, because you may have noticed that original ACEs list doesn't include things like poverty or racism, and this is because the study was done on, I think, middle-aged, middle-income white males. So when we look, so we sort of broaden the concept for young children, and the poverty is a key factor that we're going to see in. It's present, way too present, in the lives of infants and toddlers. And when it happens, it literally gets under the skin of babies, and it impacts both the neurological development as well as the physiological systems. So we've known about the gaps that develop in children who have lower socioeconomic status, and that age 2, they lag behind in language and in cognitive development, and even sometimes in social emotional development. But with the technology we have now, there have been studies that show that poverty can be associated with diminished brain growth in areas that are important for emotional, for regulation, for cognitive, for language, and this is very concerning. But to go back to some of the things we heard last night, but also the early relationship slide, the one thing they found that really mitigates and buffers children from those effects is really strong parental support. So that might be a clue for public policy about what's important to do. And the way it works is that poverty brings these material hardships that are hard on families, but it also increases family stress. And babies pick up on that stress. When the stress is intermittent, we all need to learn to deal with it, right? So that's not a bad thing. But when it becomes chronic and unrelenting, then we often refer to it as toxic stress, because it releases hormones that kind of bathe the brain in chemicals that can undermine the development. So all of these conditions lead to real problems later in life. So I hope that what you'll take away from this is that the challenges like economic insecurity and material hardship and stress undermine babies' healthy development. Having strong parental support with less stress in the family helps promote stronger development. So let's move to the next slide, which is really talk about let's moving towards State of Babies and thinking about investment. We worked with First Focus on Children to look at the share of the federal budget that goes to babies, and you see that it's very small. The share overall for children has increased over time, although it's certainly had its ups and downs. And for babies, it bumped up during the pandemic, but now it's really back down to a little bit less than it was in 2017. So clearly this shows that Congress is not, and policymakers in general are not really responding to what the science tells you about investment. So when we look at the next slide, we'll see how important that is. So to compare that small share of the federal government, not the federal budget, with research from James Heckman, who's the Nobel laureate in economics, who's at the University of Chicago. And he looked at different interventions and found that the early years are one of the best investments that we can make as a society. And not only does it help address early adversity and prevent problems now, but it also prevents costly health problems later in life. It can promote better graduation rates, better and greater earnings as an adult, and again, better health. So that gives us the highest rate of return, and you can see that it diminishes as you get for later in life. But we see that this is not happening both from the budget and from, as we look at the extent to which programs at the national level especially reach children. So next slide. We firmly believe that public policies can really change the odds for babies, and that for the long term, as I said earlier, it'll impact the health of the nation. So our policy agenda is broad and wide-ranging, and we focus it in 3 areas of what babies need to thrive, which is good health, which includes mental health, strong families, which is economic policies, child welfare, family supports, and positive early learning experiences. So our State of Babies data is actually framed around and organized by these 3 categories. So we'll move on to the next slide and start digging into the State of Babies Yearbook, which tells the story of 11 million babies in the United States. We use 90 indicators of demographics, of child and family well-being, and policies that support families and young children. And we put those into a national profile and state profiles as well. The data are drawn from national databases that have relevance to child development, but also can be divided down by states. We are able to use an equity lens because we take every data point that we can do this with and disaggregate by income, by race and ethnicity, and by urbanicity, where we can do that. And then finally, because most of you probably know, if you dug into data, that these big databases from the census and other places lag several years sometimes. We use data from the Rapid Early Childhood Survey that comes out of the Stanford Center for Early Childhood, and they give us the data on families with infants and toddlers, and we are able to look over time at what's happening to families. So anytime you see a trend, that's where it's coming from. And I just want to point out that when you go to State of Babies, it's really 2 parts. It's the profiles, which is all the data that you can find for your state, but it's also the report, which is what I'm going to really focus on today. But before I do that, so I'm missing a slide from this version, and I'm not sure why. But when I send out the final package, I will put it in. So Rachel had asked me to talk a little bit about different states, and I was going to show you. Actually, we're missing several. Oh, okay, so no, I'm not there yet. I'm getting ahead of myself. Okay, so we're going to move into the demographic findings, which the first one is that babies are more diverse than ever. More than half the babies, 52%, in the United States are children of color. And this is really, it's fluctuated a little bit, but now it seems firmly in that column. And we see this as a source of strength and renewal. But right away, you might think of a connection back to one of the adverse experiences that young children, even at age 0 to 3 can face, which is racism. And we go to the next slide. We can see that poverty and income are really defining factors for way too many babies. And this is connected to or intersects with race and ethnicity. And let's see, if you can click. Again, this year we looked at deep poverty for the first time. And it's really startling to see that for Native American and Black infants and toddlers, their rate for deep poverty is like 20%, which is higher than the average of for all poverty for all babies. So you have this not only this intersection of race and ethnicity and income, but this greater likelihood of being in really serious economic situations. So if we move to the next slide, we also use the data in a different way. We use it to place states in ranking tiers, basically placing them in quartiles, according to our GROW ranking, which is getting started, reaching forward. I can't even remember the last one. The third one, which is improving outcomes and then working effectively. And it's really, they're all compared to each other. It's not like an absolute score, but in general, you will see that the states in the top 2 tiers overall will have more higher indicators. And then in the bottom tiers, they will probably score more poorly in well-being indicators and generally lack supportive policies. So this is the slide I thought I'd lost. If you go to the next one. So I did take a few of the states that I think are represented here, so you can kind of see, in general, this is true that they score better, but you can see Colorado is kind of all over the place in terms of the different parts of the framework. But in general, states in the highest tier will have higher scores compared to the states in the lowest tier. But I think that it's really important to focus on your own state and not obsess too much about where it is. And especially if you're in a W state. I know we have somebody here from Connecticut. And Connecticut is the most W state you can imagine. But if you look at, you start just aggregating the data, you can look at low birth weight, for instance, for Black infants, which we'll see is a big problem nationally, but it's 60% higher than the average in Connecticut. In Alabama, it's 52% higher than the average. So the actual percentage for Alabama is much higher, but you can see that the disparities are still there in Connecticut. So it's really important for people within states to dig into that disaggregated data, because that is the real story of babies in the US. So move to the next slide. We're going to, as I said, we connected some dots for policymakers this year, and we found 5 urgent priorities for babies. So I will dive into them right now. And some of them I may talk about more than others, although it's hard not to talk about all of them. The first one is the crisis in maternal and infant health. And so I know that probably all of you are really familiar with the data, so I'm not going to dwell on it, except for to pull out a couple of points. The data have always shown that there are great disparities in maternal health, particularly for Black women and birthing people. So we see these also mirrored in outcomes for babies at birth, and we found that it was really important for 0 to 3, which has been traditionally more associated with babies, but we really try to work in maternal health as well. But it's important to add our voice to this urgency of this crisis that we see. Let's see. So if you move to the first slide, this is the rates for maternal mortality, which we don't use by state for reasons I can go into later if you want to know, but you can see the obvious disparities there. If you go to the next slide, you can see that these disparities are also reflected for outcomes for infants. And all of these disparities reflect this lack of access to quality care, or even sometimes care at all, but also the broader social issues, including racism and discrimination, which we know that especially Black women and birthing people are likely to experience. The next slide is something new this year that we started to look at states' reproductive health policies. And we weren't able, they changed so fast, we weren't able to get them into the profiles, but we did include a map. And what we did was we considered these policies to be a significant aspect of maternal health, as well as child and family well-being. So that's something the yearbook tells us quite a bit about. So if you do click one more time there. So if you look at the states on the reproductive health map, the purple and blue are the ones with the most restrictive policies. And then if you look at State of Babies, you can see that roughly the states in the lower two tiers in terms of well-being of their babies correspond to those states. And we just think it's really important to know what's happening when women and birthing people do have to give birth in those states. So next slide. The policy responses are laid out in the report. I'm not going to go into detail because I'm running short of time. But I think one of the encouraging signs was the state take-up of the option to extend Medicaid coverage postpartum for 12 months. And it's up to, I think, 46 states and maybe more that have adopted it or are in the process of it. And I think that's a very encouraging sign that they were so eager to take up that option. So moving to the next priority, it really gets to the opportunity to promote positive infant and early childhood mental health from the beginning. So we know that it's a period of time that's really important, and we talk about the threats, which is actually what I'm going to talk about now, but it's also, if you think about it, you're starting out with probably the most blank slate you can. You have this opportunity to build positive early mental health that can really support early learning going forward. So we've moved to the first slide. We look at what are the stresses that babies are experiencing. And you see this one is the parental stress scores. And the rapid survey followed this all throughout the pandemic, and they were very high early on. But even in 2022 and early 23, they're still elevated, and in some cases elevated to a level of some concern. The other findings that we didn't include slides for are babies also were reported to have higher externalizing behaviors, which I think is consistent with what other reports have shown. And childcare providers have very elevated stress levels, especially, which, because they are an important source of adult security for babies and adult relationships, is very concerning. So moving to the next slide, we have some external kind of indicators that we do pick up in the yearbook. And we have two measures of adverse experiences, which are, again, this expanded list that include poverty and racism, as well as things like child abuse and neglect and parental substance use. And you can see we've looked at it by income, and this is where you can see the economic insecurity coming through of the rates for babies and families with low income are much higher than the rates overall and the rates for above low income. And this is true for housing conditions and safe neighborhoods as well. And then the last slide is, in this group, is about food insecurity, which plays a big role in family stress, as you can imagine. This is by race and ethnicity, and the overall level is 14.2%, and that's pretty concerning when you think about the number of households that represents. But you can look, especially for American Indian, Alaska Native, for Black infants and toddlers, and for Hispanic, that those rates are really elevated to a level of great concern. And we see this also all throughout the pandemic, that those are the families that were impacted most. Oops, I'm sorry, I'm trying to keep up on my notes here. So I'm not going to go in there. We have a lot of detail in the report about building a better mental health system. But later, I want to pull it all together of some things that are before Congress right now. Things like the enhanced child tax credit could help alleviate family stress. There's a growing WIC crisis in terms of funding. So you WIC is not fully funded. States may have to start turning families away, and yet that is a source of alleviating household food insecurity. So let's move to the third issue, which is a commitment to early childhood education as a public good. So I think we talked about this last night, that childcare and early learning programs are really important from the child's point of view, as well as from the point of view of helping families go to work and provide for the economic security of their children. We looked at the parental use of care. A lot of this comes from the RAP. In fact, most of this comes from the RAPID survey. And you see that it's actually rebounded over time from the early stages of the pandemic, which is a good thing in many ways, because it shows parents are going back to work. But if you go to the next slide, you can see that there are very different patterns of use depending on the income of the family. So that families in poverty and with low income tend to use more parental-only care, while and not so much some less of non-center-based care, but very little center-based care. And the opposite is really true for families above low income. And so some of this could be preference. You can see probably that families are juggling. They may not be able to work full-time because of their childcare needs, so they may be juggling parents taking care of children. But it's also a matter of cost and options that are available to those families. So moving to the next, I'm sorry, I'm going backwards here. Okay, so we also have data on childcare providers specifically that that care for infants and toddlers, and we looked at the reasons behind difficulty retaining staff and recruiting. And as you probably won't be surprised to know that low wages was the #1 reason, but also burnout. So 50% of those providers reported high levels of burnout. And as I mentioned before, the stress. So this is creating a whole problem, destabilizing our childcare system. And to move to the next slide, so policy recommendations. Some of you may know that there was a big stabilization fund that was put in place during the pandemic. It expired last September. Our #1 priority right now is restoring some of those funds. And then in the long term, we clearly need a comprehensive child care and early learning solution that works for families and for providers and for babies. So moving to the fourth priority, so I was excited last night to hear the conversation about its housing, is that we elevated this year. It's not an issue 0 to 3 has done a lot of work in, but we felt it was important to elevate the importance of what we call the hidden developmental threat of unstable housing. So for babies, a stable home provides more than just shelter. It's really the emotional and social center of family life and of their security. It's an essential part of strong early development. So when we talked about why poverty has such a detrimental effect, it's because it creates conditions where how children may live in more crowded housing, their environments may be more chaotic, their parents may not be able to give them such responsive care. So we're going to move to the first data point, which is something we've tracked from the very beginning, and that's the percentage of babies in crowded housing. And I think it's about 15% overall. But as you can see here, that there's a greater likelihood that children of color will live in crowded housing. Now, some of this is there's a cultural preference element of families that want to live in multi-generational households, and that's really important. But we also know that because there's this confluence of race and ethnicity with poverty, that it still can be a danger to the child's development, and it is this balanced out by the fact that you probably have more loving adults around the child. But we also know that lacking a stable house or home, it creates a greater risk of food insecurity as well as poor health outcomes. But one of the startling findings of people who have dug deeper into some of the ACEs research is that when you have poverty connected with also with crowded housing in early childhood, that creates a much higher risk for early mortality as an adult. So clearly the effect of this adverse experience can be long-lasting. The next slide is just more, it's the crowded housing by income, and also the families that have higher worries about meeting their mortgage or rent payments or paying for their utilities. And the point I would make here is if you look at the second and fourth bars, those are worries about these things, and you see how high there is. That creates stress. So whether or not they, in the end, they're able to pay those payments and meet those payments, for a child, they really pick up on that stress of the parents of constantly worrying about paying the bills. Again, housing is very complicated. We heard last night, the broad housing policies. We've also looked at some solutions that are being tried to give families with young children some priority. But one thing I want to go back to is the child tax credit, which the study showed that when the enhanced credit was in effect, the housing was one of the really big uses of that credit. So now we're going to move to the last one, which is really the one that's permeated all the other, which is the economic insecurity that engulfs many babies. And when you think about that earlier chart, which I'm not going to show you again, but it's not just the deep poverty, but for Black and Native American and Hispanic infants and toddlers, their rates of living in low-income families for Black and Native American is 60% or more. Babies live in families with low income. So there's this significant developmental threat that you can see from the science. So the next chart is really looking at who had financial strain during 2022 and early 23. It probably won't be as big a surprise that families with low income and poverty had a much higher rate of having some difficulty meeting their basic needs, and certainly more likely to have great difficulties. And then the bottom chart is really the food insecurity that I promised you by income level. And again, not a surprise that families with low income and poverty would have much higher rates than other families or families as a whole. So assuring that families with young children have equitable access to financial resources is really key to helping them address a lot of other things, including child welfare. And I would love to get into talking about the aging out, talking about what happens to babies when they're in the child welfare system. But there's a lot that happens because families simply can't meet their basic needs, and it kind of spirals into a situation where they may end up in the child welfare system. So I'm going to go back to hammer on the child tax credit is a really clear and obvious way that families could get more resources. And we can talk more about that if you want, about what the research is showing. So on the last slide, I wanted to maybe connect the dots a little bit more, obviously, and show that there really actually is a disconnect between the brain science, between what we see in the data about how babies are actually doing, and about policy. So we know that stress and hardship and anything that really interferes with that emotional support that babies get from their close, trusted adults is really important for early and can impact early development. And we see from State of Babies that there are these indicators that families are under great stress, that children have experiences that can undermine their development, and then especially in the case of economic insecurity, we are not talking about an insignificant number of babies. I think a lot of times policymakers think of children in poverty as this little group over here or with low income, but low income is almost 40% of all babies, and of course much higher for children of color. And so it's not insignificant. But we also know that there are ways to mitigate this, to prevent some of the damage, to really invest in our children and get the highest return. But we see the current congressional decisions aren't heeding the science of early development or the idea of a return. It just doesn't come up. So the child tax credit, as it now stands, excludes babies and families with little or no income, and also many immigrant children, by focusing on the parents' work effort or the parents' immigration status. And yet we know from State of Babies that 1/4 of babies in poverty have no parents in the workforce. So they are totally shut out of this income boost because their parents aren't behaving as they should. And yet you know that those are a lot of the babies that are in that really deep poverty category that could benefit from having additional income. And then I talked about full funding for WIC. It's not in either the House or Senate appropriations bill. There's a lot of work to try to find a way to fund it. If not, that doesn't happen toward the end of the year, states are going to have to start turning families away from WIC, which could really, it helps nutritionally, it helps babies' development, and it obviously helps with food insecurity. And then the last thing is I talked about the stabilization funds. That for childcare, which are on the back burner, and yet we already see from data that's coming in that for programs that have lost that funding, tuition is going up for parents in many of them, and that providers are having to roll back wage increases, and it could lead to more closures, greater shortages. If you've been looking for childcare, you know there's already a shortage of childcare. And so these are things that are there right now, that if you looked at them through a developmental lens, you might at least discuss a different way of approaching them. On this slide, I'm not going to dwell on these, and I feel really bad. We talked about the importance of lived experience, and we do work to integrate the stories that we get from our families who come to Strolling Thunder, which is our Washington sort of fly-in for babies and families to meet with their policymakers, but I'll put them in the slides that I send out. So this was about the child tax credit, and families tell us about what they have to take on second jobs, or they can't find childcare that they can afford this even close by, or even far away. It's hard to find, or parents have to make decisions that one of them will stop working because the cost of childcare is just prohibitive and it's just not worth it. So it's these challenges of families that really are trying hard to give their children such a great start in life, and they have to make wrenching choices all the time. So if you keep moving to the next slide. So I'm just going to close out with a plug to go to stateofbabies.org, look at the profile data for your state. I'm happy to help you sort through it as well. But it is meant to be used in conjunction with the report, which kind of gives you maybe a roadmap for some of the data. We don't have the rapid data by state yet. It's not a big enough sample, but very informative. And then the last thing, my favorite thing, is to compare indicators, which you can look at individual indicators, for instance, the infant mortality, and it also gives you a nice map. So at a glance, you can see where babies are doing well and where they're not. And so with that, I'm going to close out and just say thank you for the opportunity to talk to you today, and I'm happy to try to answer any questions.
Why don't we come over here?
Okay.
So I want to dig a little bit more into what you were saying about the GROW indicator and sort of the ways to get at that disparity. And obviously I'm sort of struck by that because the story in Connecticut is one of huge disparities. It's the most segregated state in the country. So I guess, can you just talk a little bit more about how to think about the GROW indicator and how to use your resource to dig a little bit more into those disparities in our states?
Right. So, so the indicators are the average, or based on the state averages. And we've not been able to go down and like take, for instance, so if we look at different populations, what it would be like. So they do reflect the state averages, and on average, Connecticut is doing really well. And it also has a lot of supportive policies, and that will impact what their ranking is. The other thing I will say is we don't always have the indicators that we want, and we try to limit the ones that we use in the ranking to those that have the most relevance for child development and aren't ambiguous in what they mean. So for instance, the cost of childcare as a percentage of parents' income, we don't actually use because it's not clear what that means. Sometimes a really low cost percentage doesn't measure anything about the quality of that childcare, so we decided we would drop it out. But what you can do when you go to your state profile is for not all indicators, but as many as we can, you can look at that disaggregated data and you can tell what is going on for different racial and ethnic groups, for income, groups of different income, and also for some states it's really critical to look at the urbanicity of it. We have an urban-rural split. Some of these, I will say, depending on some indicators, you can't go that far down because of the sample size. And we've had to combine several years of, especially of the National Survey of Children's Health, which is a really important database for things like the adverse experiences and some of the other sort of qualitative indicators. But it's really taking the time to go in and dig down there and realize that to some extent the state averages may reflect more sort of the population makeup and not what individual groups are experiencing. So I think it's important to do that. Unfortunately, we don't have a way to look at, so say for instance, the birth outcomes for Black infants or Hispanic infants or whatever group in the compare indicators. If anybody needs that, I have this insane spreadsheet that we can pull from. But so when I looked at the Alabama-Connecticut comparison, I think the low birth weight percentage for Connecticut is something like 14%. It's like 18% in Alabama. The point I was trying to make is that the disparity between the rate for Black infants in each state is, it's obviously much higher than the average, and it's a greater disparity for Connecticut. So I do think it's important for states that, especially if they have sort of relatively small populations of children of color, but to still look at what's happening and kind of sort that out of where are they in the state and what are some of the responses. If that helps.
I've spent the past year reporting on these issues in Louisiana and our horrible infant mortality crisis there, and I wonder if you could give some advice or suggestions on one of the issues that we face with a lot of our reporting is that so many of our readers dismiss it as, well, this is only for people in poverty, or this is only for people in rural areas, or whatever. It doesn't really apply to me. And how do you kind of get past that barrier and force people to grapple with, this affects all of us?
I think that is so I direct our federal policy work, which means I direct our government relations work, and that is the number one thing. How do you get people to care because they feel like they're othered? And one of your senators has a famous quote that it really shows that's where his head is. And so part of it is I think we try to show that there is a significant proportion to look at some states, and we did a report that we haven't issued on the Sun Belt states, and for a lot of those it's not necessarily broken down by racial lines. You will see higher poverty rates for white infants and toddlers as well. So it's just, I think it's the significance of trying to get across that the state's well-being depends on all young children really thriving, and in the long term, productivity will suffer. I do think it's a hard nut to crack. There's all of in these states, when we did the study, it's clear that there's this through line of not believing in government interference and believing in individual responsibility and not taking ownership of the policies that have created some of these situations. And so I think it's really hard to message that. But I think anytime you can try to show the impact of the state economically of not providing economic opportunity for all families and children, I think that can help. But I'm from South Carolina, so I can talk about these things. I just think it's just a hard nut to crack.
Take one more before I jump in. Does anybody?
Hi, Leah Wong with USA Today. Thank you so much for the presentation. I'm curious what your outlook on 2024 is. I mean, it seems like we are on the cusp of making some baby steps with the expanded child tax credit. So, I'm cautiously optimistic about that, but it's scary to think about the implications of the presidential election.
Sort of same. So the child tax credit, there is a very small improvement. Actually, what's so strange about it, so it doesn't do full refundability, which is what we wanted to get to all of those babies who basically their families have almost nothing. And so we talked about gaps in that you can see in development. And this is almost like purposely saying, okay, we're going to exacerbate that gap because we're not going to give the children who have basically nothing anything, and we're going to give everybody else more because their parents are earning a certain amount. And it's not that they don't need, that those families don't need it, but what's so strange about this improvement is it actually solves a problem that I don't think most of us knew was there, which is that people in lower income brackets get less of a tax credit for like the second for multiple children. So it's going to improve that, and they will get more. And anytime you can get more cash to low-income families, then that's a good thing. But so it seems like that has possibly a path forward. We're obviously worried about what will happen in appropriations. It doesn't seem like they're going to be high enough to get to even the increases in early learning that the Senate had. And then there's the idea of trying to get billions for emergency child care funding it's still sort of rolling around, but it's not there. And I think that after they get appropriations, it's probably that's probably it for the year. And so we're all looking at what will happen. What will the Congress look like next year? It's already, as you know, the House is in chaos. The cuts in their appropriations bill to things like, so they left childcare basically level, but they slashed Head Start. They zeroed out a number of programs like Healthy Start, which is an important program for infants and infant health and maternal health. And so it is very concerning. We came so close and Build Back Better. I was so excited. Half of our big agenda was going to be done in one fell swoop of a big child care program, the child tax credit possibly, and some form of paid family leave. And we lost particularly the child care where we came very close. So it's looking like not much more will happen, very small steps. And then it's kind of hunkering down to see what happens in the election.
I'll take one more if there's another burning question before I ask my own final question.
Jenny Wong, Connecticut Mirror. Do you have any tips for journalists who are, I'm thinking about what you were saying about brain development and how it can be sort of disrupted by poverty. I guess I fear by writing about that, we could run into reinforcing stereotypes about people in poverty as less than.
No, I agree, and it's hard, and it's also hard. We have on our parenting side, they really worry about the messaging from the policy side that it feels inevitable, and it's not. The brain is very plastic. That's why we have interventions that really. That can really mitigate some of the issues with development. probably the best thing you could do is help families increase income. It doesn't necessarily have to be by tax credits. It could be by minimum wage. It's this idea that all families need the ability to support their families economically. And that's one reason we look at families with low income. That goes up, and I don't know what it is off the top of my head for Connecticut. It's probably much less. But again, it's almost 40% of babies live in families with low income. That really speaks to the wage structure in our country, and trying to maybe connect it back to those things, and really showing that the investments do pay off. If you give all children this opportunity, and really try to right the inequities that are present, that if you give all children the opportunity to thrive, you can make these investments. They will pay off down the road. And it's very, the Birth to 5 childcare program that a lot of the research that Heckman does is based on, and it really does show greater graduation rates, greater attendance in college, better earnings as adults. And one of his findings that he added to it was better health outcomes. So you're really saving money on the system, and you're creating this society and this workforce that is going to be more productive. And we try to connect it to that. I won't pretend to have all the messaging that works, because as you can see, so we've worked really hard. I think people understand that the early years are important. One thing you can also fall back on, if you talk about the ACEs study, those were not poor, those children were not poor, those men were not poor when they were young. They were in middle income families. And yet almost all families have some kind of adversity. You could probably say all families do have some kind of adversity, and a lot of that may impact their children. Certainly substance use and alcohol use does not isn't confined to certain income groups. And those experiences for any child will have an impact later on. And that is why the ACEs study doesn't get to some of the realities a lot of babies face, but it also shows that adversity in and of itself, no matter what your income level, can still have an impact later on, and that impacts health costs and productivity cost as well.
I am wondering personally, if we look at the persistent, continuous ranking of an Alabama or a Mississippi or Louisiana at the bottom of all of these lists of indicators, because the core theme of this training is economic stability for children and families, and what are the systemic barriers? Is it possible to quantify that positioning as being at least influenced by systemic barriers? Why the system in those states is set up from the get to block or bar poor people from succeeding? Or is that taking it too far? Is that trying to?
I don't think it's taking it too far, and so we tried to get at this report that I'm still struggling to get out on looking at Sunbelt states, but because a lot of it is still the legacy of the enslavement of people, of prejudice against and discrimination against Latin people, of the treatment of the Native American peoples. And that legacy is all built there, and some of the policies are still influenced by it, and that lack of will to do anything about it. So one of the themes of this report is the Sun Belt boomed economically, and yet a lot of the jobs that were created are really at the low end, and those are the jobs that might be available to the people who have over generations have been in lower incomes. But I'll give you another example, and one of it is, so the only cash assistance program that is left in the federal public assistance panoply is the Temporary Assistance for Needy Families, or TANF. And I think it's pretty well documented that states with high percentages of people of color are more likely to use a smaller proportion of their TANF money for direct cash assistance. States get to decide what they want to do with it. And so I think nationally, I think it's down to like 19% of it goes for cash assistance. And some of it goes for training, some of it goes for childcare, but they can also transfer it out for other functions like child welfare that are things that maybe the state doesn't want to pay out of its own budget, so they raid their TANF funds. So in Arizona, they spend, I think it's something like 60% of their TANF money goes into their child welfare system. And our data shows that they have a really high removal rate, especially for Native American and Black children into their child welfare system. And if you stop and think about it, you might say, what would happen if they spent more of that TANF money on giving families in poverty more cash assistance? Would they alleviate the need of the number of children coming into the system? So yes, I think that there's been a lot of work done to look at policies like that and see how they're driven. And there's this, again, as I mentioned earlier, this feeling that government doesn't have a role, that you don't want government interference, this resistance to Medicaid expansion, except for Louisiana has obviously adopted it, but a lot of states won't because they just don't see the need for everyone having access to health care. Interestingly, I said this has been a record year for the Affordable Care Act marketplace plans, and the highest level, the increase has been in states without Medicaid expansion, so people really are looking for health care. So I think it's been documented. I will say that's probably not my forte of doing that kind of research. We tried to bring that in this report because I think it's really important if you look across these states that some of them you'll have sprinklings of different policies, but on the whole there's a lack of supportive policies. There's a general low minimum wage, so not so much looking to raise families out of poverty or out of low income through having a better wage structure, lack of paid family and medical leave, which of course is pretty general across the country. A few states have a child tax credit, maybe a few have a higher earned income tax credit, but in general those policies are kind of lacking. So there's not this feeling of we're here to provide to really ensure the welfare of all of our families and young children, and I do think that a lot of that is driven by racism, and and I think there has been a fair amount of work to kind of document that.
We could clearly keep you here all morning.
And I would stay, but this has been really
exploring
great.
these issues, but I just wanted to personally thank you for expanding my own grasp of the importance of this issue. And I'm sure the journalists feel the same way. So let's take this opportunity to thank Patricia Cole of 0 to 3.
Thank you. It's a pleasure.